My name is Ana Carolina Alencar.
I'm Marília Fávero.
I'm Luisa Schroeder.
I'm Maria Luisa.
I'm Luma.
And I'm Vitória.
And we are students from the Pan American School of Bahia. And today we're going to talk about our two projects. Yes, we had two projects. One that worked and another one that didn't work. So we're first going to introduce the project that didn't work, which was Medeco. So the proposal from Medeco was we wanted to raise awareness on how to correctly dispose medicine, any type of medicine, because we don't know, but when we throw medicine on the trash or the toilet, it's affecting the environment, our community, and ourselves.
Our main problem was that it was proven that the residues from incorrectly disposed expired medicine cause a serious impact in our environment and in ourselves.
Yeah, one example that is very, very harmful to our environment is when these medications are flushed down the toilets due to the fact that the chemical substances of the medicine, they affect the water and they become a part of the water and the soil, which many times cause genetic alterations in plants and animals that we consume. Another example that is like very, very harmful to our environment is when these medications are simply discarded through a trash. When you throw a medication in the trash, due to the fact that trash bins, they are very, they have an easy access to kids, and it causes like kids to like have contact with these medicine, and many of them end up being sick. And they also end up in landfills, which also can contaminate rivers and oceans. So it's very, very, very harmful.
So, due to these concerns, the aims we had in order to try to solve these problems in our community were by creating awareness through posters, announcements, and flyers. And we also attempted to collect expired medication from
However,
So you guys might be wondering what is the correct disposal of medicine, which we all have been talking about for so long. So how can it be disposed of the medicine? The first step to disposing of medicine correctly is actually acknowledging that there is medicine that is expired at home, so you should check on that first.
Not only expired, like if you
So that is the first step, and after that you should separate the medicine that is expired and take it to any pharmacy that is nearby, because usually pharmacies do have the disposal, which is correct for the medicine. And at the disposal station, you should deposit the medication, which is in 3 separate stations.
Sorry for the interruption, gym participants. There's been a question about whether or not we could get some Lincoln sweatshirts for sale for people that are cold. We have arranged to have some sweatshirts for sale. They will be for sale for either 500 or 600 pesos, which is what our parent group sells them for, and they'll be available immediately across the entrance to the large seating area, the auditorium, and they'll be ready for sale at the conclusion of this student workshop session. You can also buy water bottles for 200 pesos in the same location. Those things will be for sale when this session is over. Thank you.
Okay, so continuing. At the disposal station, there are 3 sections in which the medication can be disposed, which are the parts for ointments and tablets, the parts for liquids and sprays, which is like the different parts of the medication, and for the boxes and inserts, which is the packaging. And the same procedures apply to medication that you just want to dispose of. It doesn't necessarily have to be expired.
So our main conflicts, we faced the conflicts with the administration in our school. We weren't allowed, since we are underage students, to be responsible for medications. And we couldn't leave a container without full-time supervision in our school, since it would put other kids in danger. They could, little kids could go and grab the medicine. So it was for safety reasons and responsibility, because our school, our principal, he owes our school safety, and it was also a cultural conflict since us as Brazilians, we didn't imagine that would be an issue. While in the U.S. it's very common for those things to happen, and our principal, being American, he thought about that.
Okay, now we're going to introduce our other project, which is Hope is Pink. And we chose this project because it was getting next to October, and we saw that there was a lack of knowledge on breast cancer throughout our school, so we wanted to bring the awareness to PAS.
Okay, so the problem is that the lack of knowledge of the students from our school towards how common breast cancer is, what are the preventions we as women and men can take to don't go through this problem.
So we brainstormed and came up with an essential question. How can we bring consciousness about breast cancer in Belgium?
Okay, guys, so I want to ask you all a question. Do you know what is breast cancer? You.
It's when, well, we get cancer, breast diabetes, but there's like it forms in breast, and then sometimes you have to cut them off because it can spread to other parts.
That was great. And if you didn't listen to her and want to get a better idea of what breast cancer is, we're just gonna explain to you right now.
So breast cancer is actually a deficiency in our body, and it's due to several risk factors. There's no specific risk factor which will further be explained, but what happens is it's a process of cells reproduction which goes wrong, and our body starts producing cells that our body doesn't need, and it forms a tumor.
So, as Marília mentioned, there are some risk factors, and some of them are if some of your family member they have breast cancer, there is a possibility that you might have also. There is also, if you're a girl, if you had an early menstruation at the age of about 12, before 12, you might have a possibility of having breast cancer. If you are also a woman and after your age of 55, you have a late menopause, you might have a possibility, and also environmental causes, because many people don't know about that. For example, aerosol sprays, if you inhale too much of it, it might cause you to have breast cancer. Although, guys, these are not necessarily the cause of breast cancer. There is 60 to 70% of the people that have breast cancer that have no connection to these factors, and it is proven by doctors that there is no specific cause, no specific factor for breast cancer.
However, even though there is no specific cause, here are some symptoms of how this disease can affect you.
So one of the symptoms is a change in skin texture of the breasts, or an enlargement of the pores in the skin of the breast.
A lump in the breast.
Continuous pain in the breast or in the armpit area.
If one breast is becoming larger or lower than another.
If the nipples become inverted or if they change in shape.
If they develop a little rash or crust, which produces a discharge.
If there is redness and scaling around the nipple area.
And if it's swelling under the armpits area.
So here are two pictures of what is happening during the month of October. First one is in Dubai, and the second one is in Tower Bridge in London, in the United Kingdom. And here's just to show you guys how there are some people who are trying to bring the awareness in different ways, like decorating and just making these monuments, which like you can, when you travel, you're gonna see their tourist attractions. Make them with pink colors, so that people bring attention to people, so they can see.
Okay, so here's that you can see a little better.
So in London and Dubai.
And so we've decided that from now on, our community, PSB, won't be left out. As you can see, there were famous people, at least in Brazil, who are part of this already. They honor people with breast cancer, and they are to aware body of how it can be treated and prevented and diagnosed in its early stages. We have friends being part of this, and that was when we decided we would do something about it, about that in our community.
If you guys are wondering why October, it's because October is the month for breast cancer awareness. It's the 24th, the day for breast cancer awareness.
So our solution was to encourage the students from PASB to donate money and also to wear pink. So they paid R$2 to wear pink on the 24th of October. But some people were very generous and they gave more than R$2. And with this money, we bought towels to the Institute of NASPEC, which is with a partnership with FEMAMA. And we also spread the word. We did lots of posters talking about breast cancer throughout our school.
Guys, the reason why we gave towels to the institution was because we contacted them and they said that they needed towels.
Because there are many other...
These will be further explained.
Yeah.
So, FEMAMA Institute, NASPEC is a national federation to support in the sport of breast health. It is the only representative in Bahia, and it was responsible for bringing the campaign to Salvador. So it takes care of patients with cancer from 406 districts in Bahia, and their focus is breast cancer since it's the most common.
And they also have, most of the women patients are breast cancer, and they also have lots of men that had breast cancer being treated there.
So we collected more than 500 highs, which is a lot since we collect 500 highs. Since our school is very small, it was a very good amount, and they asked us for white towels for body and facial towels. So it was what we provided to them.
Okay, so here is some of the posters that we
And the previous pictures were from some of the people of our school.
As you can see, Michaela is here.
The little pink buckets we used to collect the
Some of the
money.
money.
Yeah, and also Michaela's face.
And we also, as maybe you saw in the video that was presented, that we gave like little treats for the people that wear pink, so that we could incentivize them and make them see how important it is to be a part and wear pink in this month.
It was a ribbon which represents breast cancer, a pink ribbon.
Yeah. Okay, so here are some pictures on me and Maria's trip to NASPEC.
So here we're delivering the towel to the
Owner and
representative of the institution.
Okay, so here is the nursery at NASPEC, and the NASPEC is a very humble foundation, and they don't have lots of money, but they have partnerships. The owner Romilda, she explained to us that there are people who give separate things. So I'm owner of a company, and I'm just gonna give plastic bags for them so they can put trash. I'm another owner of another company, and I'm going to give sheets. In our group, we're now responsible for delivering towels to NASPEC. So they have these partnerships.
So
Yeah.
here is some pictures of the institution. As you can see, it was very humble. We were very impressed when we got there. The illumination was very weak, so we were very proud and glad of helping such a humble place, which people like very sick or being taken care of.
And they do lots of projects in our town with FEMAMA, because they are part owners of FEMAMA. So they were the ones that bring October Pink to Salvador, and yeah, they do runs and lots of other events to help
They also
breast
put like
cancer.
these posters in the mall and in various places so that people all around town, not just in our community, can be aware of this issue.
So how is this sustainable? We, as mentioned, have now a partnership with this institution. We are the group responsible for providing them annually towels for the patients, while they also have the support from other groups. As Nacarol said, they provide plastic bags, they provide sheets, they provide diapers for the patients. So we are very glad to be part of this. And for example, in 5 years, we plan to pass the responsibility of taking care of and donating all the collected money to 6 other very, very interested members in our school. And we also will be gathering coupons, which the institution they receive as a way of donating. They will convert it to money.
Okay, so that's
Guys,
one
now
we have a game to play with you. Let's start with 5 volunteers, 6 volunteers.
So initially, 10 volunteers.
Yeah.
10 volunteers.
In this activity,
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Come on, people.
this activity is for you guys to understand some of the prevention you can take to breast cancer, and also some symptoms and.
So you can all line up here.
Let's line up in a
Facing
line.
that way, I believe.
Let's line up in a way that will fit everyone
In a straight line.
Let me face you all. So
You have to be.
Okay,
try
so
to
we're
be
gonna
as
hand
straight
in
as
some
possible. Can go like this.
cards for you
So
guys.
here's the game.
You need to
Molly
be
said-
in the same
As
level.
Malu said, you all are going to receive cards and they're going to have some symptoms of breast cancer. If your symptom that you got, you read it out loud, and if it's a positive symptom, you'll move one step forward. If it's a negative symptom, which means that you probably have breast cancer, you move one step back. Who wins this game will get a prize.
And also, guys, it doesn't only involve like symptoms. We also have like measures that we can take to like prevent breast cancer. So it's like you're gonna see, and you, as Lisa said, it will be identified if it's a positive or a negative action or symptom. So if it's a positive, as mentioned, you go to the front, and then if it is not, you go to brackets. And who wins is gonna be the person that is able to go here, like that is most.
Okay, so whoever wins is gonna win a T-shirt from the institute that we donated the money to, which is Naspec, as a guest of team, which we got there.
Okay, okay, let's start.
So we're gonna go in order.
Yeah.
Yeah, you just
You
can
read
read
it
your
first.
card out loud.
Okay, first card.
I'm not an alcoholic.
So
You're not an alcoholic?
you can-
Okay.
One step forward.
You can take a smaller step, otherwise
I
you
don't
won't have
practice.
space.
I don't practice physical activity.
You think that's negative? Okay.
I am obese or overweight. Guys, maybe we should take less people.
No, it's fine. You can just like come a little further so that you can go backwards if you need to. Yes. So please,
Okay,
Guys,
next.
and please specify if it's like this is
negative or positive, and say
Negative.
I have had chest radiation. Negative.
I don't practice physical activities. Negative.
I am obese or overweight. Negative.
I am obese or overweight. Negative.
I don't practice physical activities. Negative.
I have annual checkups. Positive.
I am an alcoholic. Negative.
Okay, so let's start again.
One of my breasts is getting bigger. Negative.
So you're back. No, you're
Okay, yes.
neutral.
I have had hormone replacement therapy. Negative.
hormonal.
I have a family history of breast cancer. Negative. I have reached menopause at age 58. Negative.
I'm taller than average women. Negative.
The size or shape of my breast changes.
Had my first period at age of 12. Negative.
My armpits started swelling. Negative.
I am over 60 years old. Negative.
I don't practice any physical activities. Negative.
Neutral.
Okay, so next round. Flip your cards, please.
I don't practice physical activity. Negative.
I'm an alcoholic.
I have cosmetic implants. Negative. I don't practice physical activities. Negative.
I never had a mammogram. Negative.
I have had hormone replacement therapy. Negative.
I have or had breast lumps. Negative.
I don't have a child. Negative.
I had a mammogram. Positive.
The size of my shape of my best chain.
No family history of breast cancer.
Positive.
Positive, yeah.
I have had continuous use of oral contraceptives.
Oral contraceptive.
Negative.
I have advanced breast tissue.
I'm 47 years old. Negative.
I have a dense breast tissue. Negative.
The size and I have a dense breast tissue.
I reached menopause at age 50. Positive.
I'm an alcoholic. Negative.
I went to a doctor. Positive.
I am overweight.
Oh, thank you. Clearly, we can see that we have a winner. So, what's your name? You survived, Alejandro. You survived that.
Guys, that wasn't for me.
Many negative aspects to it, but there's also positive.
It fits you. It fits you. It's large.
Guys,
Large enough.
so guys, what you can take from this experience in this game is that it is not very easy for us to, like, it is not
Being aware of breast cancer is really common. People aren't usually aware of it. These are like the main symptoms of it.
so this shows that, like, for you to, like, prevent yourself from breast cancer, you have to be just like our winner, who tried to do as many things like as mammographies and went to the doctor, mammograms, and went to the doctor and was aware of the size of his breasts and all of the other symptoms, so that he was the one that could prevent himself best. And the other people that didn't pay much attention in the symptoms or didn't care or didn't do mammograms, they went a step back because they weren't taking care of themselves. So this you can take from this activity, that we should prevent ourselves and that we should be cautious about the symptoms and everything, because it can happen to us as well.
And also, don't forget about the first mentioned project, which is about disposal of expired medications. This should be further research. You guys should research about this and bring the topic up in your community, since it is also a very effective issue.
Yeah, and maybe in our
every
school
single
didn't
place.
work, but you can try in your school.
Guys,
Because the bureaucracy is different, so you can try it at your school.
Try it at home. Do it at home.
In your
Don't try to do
buildings,
it.
yeah.
Spread awareness and do it yourselves. And as well, it's really important for you guys to know that men also have breast cancer.
Even
It's-
animals,
yes.
guys. Even animals have breast cancer. Yes,
Yeah,
there is
so-
a little.
How do men do mammograms?
What?
This is the real question.
It is the same example.
It's the same process. Only
Yeah.
the breasts are the size is different. It is the same process.
But
And
everyone should be aware. It doesn't matter if you're a man or.
Yeah, it doesn't matter.
And just
For men,
because
yeah.
we are teenagers right now, our actions from today may affect what will happen tomorrow. So we are bringing this awareness so that tomorrow we can be.
Guys, do you have any questions?
Yes.
Any more questions?
Yes, what's this?
Okay, so guys, we have several things to hang into you. Okay, so
Okay, so we're gonna